Welcome to our episode of Visite today. Thank you for watching again, and thank you very much for all the valuable letters and case documentations, which of course also give me the basis today for a medical history of a 64-year-old patient who was hospitalised because of a problem that has become very acute, and the diagnosis was herpes encephalitis. This is meningitis due to herpes viruses. That was in April, and until 8 weeks ago, this gentleman was only able to move with a great effort. And he describes how he felt very bad in general. I can't assess the condition at the moment, but the regeneration process was probably very, very long and probably is still not complete. That's why he asked me for my opinion or maybe some help. I have the letter here, and the emergency room showed a patient at the time who had very pronounced speech and thought blocks and again couldn't find the words. He himself describes having had a strange feeling in his stomach for a long time. However, his wife adds that he has been feeling sick and tired for a long time. He kept talking in certain phases and batches. He couldn't finish the sentences. Something kept coming into his head, and he couldn't finish the sentence. The clinical examination, which then also dealt with the whole clinical picture, showed a very reduced general status, but on the part of the cardiovascular system and so on, there were no significant findings. Now there are examinations. I assume that you were immediately admitted to a neurological clinic, and then you did different MRIs, so magnetic resonance, computed tomography first, and then magnetic resonance tomography with a contrast agent on April 9th and April 14th and on April 22nd. Then there was a lumbar puncture where they take liquor from the spinal cord, so cerebral fluid, or investigate the contamination. And herpes viruses were found. These herpes viruses are a viral reactivation, but it was treated with 2 antibiotics, ceftriaxone and ampicillin, and then with aciclovir, which is available to us as doctors, an antiviral medication first taken intravenously and then again later orally. All in all, you were then released back home in an improved general condition, and your concern or question was now, what can I do? What should I do? Because my health is still not satisfactory. It was the reason to take a closer look at your case, because you can see how we proceed medically today. We see an acute situation, we try to understand it, we find herpes viruses more elevated than bacterial processes or other viral loads, and respond to them. But we also still work with a broad range of antibiotics according to the principle, if it is not only herpes, then we also have the chance with broad spectrum antibiotics to react to a bacterial pathogen. But now it is the case that any herpes simplex virus really live in all of us. There is no one who doesn't have herpes viruses. For example, Epstein-Barr viruses. In the past, almost all of us went through mononucleosis. We can already get an Epstein-Barr virus load through breast milk. So viruses are always intracellular. I wouldn't even say organelles, they are components of the cell. And virus is not viable outside the cell. Viruses are cell organelles, so it is an RNA or a DNA thread with a surrounding protein shell. Viruses are always tied to cell metabolism. Viruses can't exist outside the cells. And to name it virus was only possible when it was discovered. That was at the beginning of the 20th century when electron microscopy came on the market. At the end of the 19th century, we already had found fungi and bacteria in the blood, and then these were given these names. So actually, parasites or fungi, bacteria, these names were already occupied. Virus is Greek for toxin. There were cell structures that couldn't be estimated well. But it was found that these cell structures, when they are activated and then multiply, that there has to be a trigger for this activation to take place. And of course the cell metabolism changes as well. I'll give you an example. We have chickenpox in childhood. These are herpes simplex viruses or herpes shingle viruses. So herpes zoster viruses. And after we went through chickenpox, an immunity is built. The best and strongest immunity. This means that with a new confrontation with viruses at this level, the chance of suffering from disease is quite limited because we have built good antibodies. You have antibodies against a disease, mostly from your own disease. And that usually lasts a long time. It doesn't protect us from getting the disease again, but the risk is relatively low. But if in the course of life you come to a phase where you own the intracellular immune system, so we have an immune system which also protects the cell itself against such attacks, reactivations, and also in our blood, in our body, we have antibodies and enough mechanisms that must be available so that the body doesn't come into this reactivation. But now it is like that. When we had chickenpox as a child, for example, then the chickenpox viruses stay in the spinal cord. That's the place where such viruses simply stay inside us in an inactive form. Now, if this intracellular activity is decreasing in a chronic process, because maybe we call it suffering from a consuming disease and we don't know it yet, so when a tumour slowly developed over the years, when immunity drops because maybe we are also chronically overwhelmed or overloaded, also often in phases of depression or very strong psychological events that reduce our immune performance. When we are contaminated with toxicity, when we are contaminated with parasites, because our immune system can't solve everything for us, or simply if our vitamin D has never been checked for years, when we lack zinc. Zinc is one of the most important trace elements, especially for intracellular immunity and so on. So there are really many reasons why the chickenpox virus can suddenly become active. Then, in old age, it is not called chickenpox, but it's called shingles, and it occurs where these chickenpox viruses stayed inactively. But it can also happen all of a sudden through a shock, through a rear-end collision, through a serious trauma. What one experiences because some member of the family maybe died suddenly and so on. All of this is always part of a development to a reactivated virus. Also, people who keep saying, I keep getting herpes at this point, but I can already tell if I slept badly or I'm in a phase where there is too much stress, then my herpes becomes active. That means, first of all, it is very important that now it's been half a year already since this event that you really question these things. Where do I stand today in terms of my immune performance? Then you should really do an immune status to recognise that. How is your vitamin D level? It is a basic requirement for any immune derailment. How high is my zinc level? It is measured intracellularly, so in whole blood, and I experience that the majority of our patients are really zinc deficient. It is so banal and it is so simple, but it will be necessary because the health situation, which was built broadly anti at the moment, should get the chance that it can really stabilise now. And for that, 3 things are always needed with every viral reactivation. The first is, please ensure that you take high doses of vitamin C, 1500 to 2000 milligrams orally. It doesn't get any higher. Acerola, for example, is a wonderful source of energy. The second is vitamin C in the form of lemon smoothies. Whisk and shred 5 beautiful organic lemons. Clean the peel nicely beforehand. Then please shred it into a puree. Mix it. Fill up with a banana and an apple. Water so that it's creamy. Put it in the fridge and drink an 1/8 once or twice a day. And the other is L-lysine. L-lysine is an amino acid which significantly reduces viruses in their activity to multiply. And remember zinc. When you've measured your zinc levels, substitute. Zinc can only be bought over the counter in 15 milligrams, but very often it is necessary in the first phases to substitute more zinc. 30 to 40, sometimes even more milligrams. You shouldn't take zinc on an empty stomach. This makes the stomach feel uncomfortable. Dark leafy vegetables, for example, are a supplier of zinc. But in a really medical indication, these amounts cannot be consumed orally. I think it's very important that you go through viral diagnostics again, because we see very, very often behind, for example, herpes reactivation, that at the same time an Epstein-Barr reactivation is happening. And trained for such also virus processes is a doctor who, aside from their actual profession, for example, as family doctor or internist, has also dealt in microimmunotherapy. Microimmunotherapy is very interesting as a therapy, which the Belgians have researched incredibly over the last few decades. And this microimmunotherapy is not about an antiviral therapy, but to identify exactly which immunological defense processes are no longer given to keep a virus in inactivation. It's not about killing a virus. It's about getting it out of the active status. These are special clinical examinations that also tell us, is there a viral load? But are they also inactive, or are they persistently active? Are they active in a reactivating way? I think that's a big difference, and of course it has to have the consequence of taking the immune system along with it, and to continue to support it in this process in the long term. Behind this is a real non-intact immune situation. To what extent is this immune situation justified? Because it may have been exhausted over the years by a persistent Epstein-Barr situation. A typical Epstein-Barr sign, for example, is being exhausted, this tiredness. Then your wife indicates or sees that the stomach is always an issue. It is important to know, how is the root of the human plant? Is the bowel healthy, or are there also loads that you are not even aware of? Is there constant inflammation that you don't even notice? Has the intestine slipped quietly into a leaky gut situation? That is if the intestinal mucosal permeability is open. And at the moment you transfer endotoxins. That means fragments of bacteria, parasites and fungi enter the body in an uncontrolled manner, thus overwhelming the immune system. That makes you tired over time. That makes you weak. The other thing that struck me when I read it was they did both a CT scan and 2 MRIs with contrasts. That is giving gadolinium. You have to sign a paper before you're being treated with a contrast medium. I've already experienced the most serious dramatic cases when and after giving gadolinium, including in a 12-year-old girl. But gadolinium is something that can cause generalised burning pain in the long run. It causes tinnitus, difficulty swallowing. It causes derailment from normal body temperature. But if the body temperature drops, maybe 36.5 degrees Celsius, the permanent oxygen pressure on the cells decreases. This is called hypoxia. And viral reactivations can occur even more than maybe before. The, let me say, discomforts that some people describe are the feeling of experiencing such an electric current, vibration, fatigue, weakness, muscular pain, joint pain, sleep disorders, disorders in the immune system, impaired vision. It is an incredible range of what gadolinium, the contrast agent, does to people, and you have received this intensively in this period. Now, of course, the question arises, what is your own detoxification performance like? Has the body been overwhelmed with this contrast agent administration? And can it actually do this detoxification process through the liver and kidneys correctly? It takes weeks to months for something like this to slowly break down. But at this moment, you should also pursue this question and contact someone who can also help you with detoxification and detoxification capacity by diagnosing more than just looking at the liver values. They are by no means the only value to find a corresponding, let's say, regeneration or support for the detoxification process. Biological medicine is actually pretty simple, and you will notice it even in the cases that are presented in different ways. We also have to pay attention to the issues of our time, so it doesn't make any sense to believe that today we can regulate everything by giving a homeopathic remedy. The body can only regulate itself again when it is relieved, and we also have to understand in the patient's anamnesis what are their weak points, because it is precisely on these weaknesses that people will develop their problem in terms of disease. And that's why it is so important, I think, to turn to a colleague now who doesn't treat you post-operatively after a severe encephalitis. It is a large and a serious clinical picture, that's out of the question, but rather pursues the question, what is still not different afterwards? And what is needed now with regard to diagnostics of toxic loads, parasitic loads? And how is your overall system actually set up? With a stool sample alone, you can almost get 12 answers to 12 questions. But that is crucial. Whether your brain can work in a very balanced way or has already experienced stress for years. You shouldn't underestimate that today we live in the aluminium age. Aluminium can pass through the so-called blood-brain barrier and enter the brain. That does something to us, and then there are often things that suddenly become dramatically concentrated somewhere, that the body can't regulate a development to an encephalitis on its own. I think these are things that you can really do right now. It's over. It's behind you. It's been more than half a year, but it's not too late to maybe take in how serious this illness was, what aftermath it gave you for weeks and months, and maybe really examine yourself as a whole to see what may then have, understandably, led to the development of acute meningitis. I hope you can now take another and perhaps crucial step with these things. I don't know, I can't tell from here whether you still have amalgam fillings. I can't tell whether you might still have dead teeth. That would be incredibly important for you to know now, and please also then to discuss it with a holistic dentist, because this will make a significant contribution to the fact that the body can recover as a whole. With this in mind, I wish you a very nice evening and look forward to next week and next Sunday evening. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.